see that you're here today to get some information regarding the HPV vaccine.
Yeah, so my main question is, what is the HPV vaccine and how effective is it against HPV?
The HPV vaccine is a series of 3 shots that is very effective in preventing most genital HPV. There are 40 types of HPV that affect the genital area, which include the vulva, the vagina, the cervix, the rectum, the anus, the penis, and the scrotum. Most of these are harmless, cause no symptoms, and go away on their own. There are some low-risk types that can cause genital warts. They're not dangerous, they can be a nuisance, and are uncomfortable to treat. The high-risk ones can cause abnormal pap smears that can sometimes progress to cervical cancer. The HPV vaccine prevents the 4 types of HPV that cause 90% of genital warts and 70% of cervical cancer.
So how do I know if I need the vaccine? Do I necessarily need to have HPV?
Ideally, you get the vaccine before sexual activity, including skin-to-skin contact. It is recommended for girls and women aged 9 to 26.
Well, I'm already sexually active, so how do I know whether I have HPV?
Unless you've had a pap that shows HPV-related abnormalities, you will not know if you've been infected. And there's no test to know which type of HPV you have, only to identify high versus low risk. Chances are that a woman will not have all 4 strains. It is advised to get the vaccine even if the woman has been infected with 1 strain.
Okay, so if I get the vaccine, does that mean that I still need to get pap smears?
Yes, since the vaccine does not protect against all high-risk HPV, it's recommended to continue to get regular pap smears. Usually we recommend pap smears every 1 to 2 years depending on which type of smear is done, unless you've had an abnormal pap. If that's the case, contact your provider to see how often you should come in to have a pap smear done.
So where can I get the vaccine and how much is it going to cost me?
The vaccine is currently available at Student Health Services. You can also go to your private doctor, Planned Parenthood, or a community clinic. Cost of the vaccine depends on your insurance status and where you get it. Check the Student Health website for our current price.
Well, I'll have to look into that and come back. When can I get the vaccine done?
The most up-to-date hours are on our website, studenthealth.ucsd.edu, or you can ask the friendly receptionist at the front desk.